Hi, everybody. My name is Liz Faust. I'm a nurse practitioner in wound, ostomy, and continence management. I work at the Reading Hospital, which is a level 1 trauma center in Eastern Pennsylvania. I'm here to talk to you today about maximizing your critical care beds and preventing OR trips with the use of Bosh. So for those of you that don't know, Bosh is a powerful antimicrobial preservative and a wound cleanser. It's pH balanced, so its pH is 5.5, which is conducive to wound healing. It's optimal for that. And the other great thing that it does is it can mechanically remove bacteria and debris from the wound base. So we tend to use it pretty frequently, especially in our chronic wounds. So with our current wound care model, especially in this time of pandemic, we certainly have our hands full in trying to manage and really prevent infection, maximize our resources. So what I'll say is that a lot of our patients are admitted with sepsis. So the CDC reports that about 1.5 million Americans are diagnosed with sepsis every year. About 250,000 of those patients will die from the sepsis. Particularly in our chronic wound care population, I feel that they're particularly at risk. In my experience, some of my chronic wound care patients have gone from like slight redness to pretty sick patients rapidly. They quickly escalate. And it's always good, especially in these COVID times, to have a little added insurance for trying to decrease the amount of bacteria. And so Bosh fits perfectly with that. Also, our patients in the acute care setting are coming in with not just chronic wounds, but acutely infected wounds. So we've been utilizing Bosh with Vacvariflow in patients who have like traumatic injuries or necrotizing fasciitis or an acute infection, just to help remove that bacteria and to help cleanse the wound, but not kill the granulation tissue. I do say that we're trying to decrease their OR times too. We're trying to conserve the use of personal protective equipment or PPE, decrease exposures, because we have to assume that everybody's positive for COVID in a way until they're showing signs. Especially in times like this where we're shifting. I don't know if you guys watched Kara Couch's webinar on wound care center without walls, where it's showing that shift in our thought process from healing at no cost to prioritizing. So like a lot of our reconstructive surgeries have been postponed or canceled. Patients are canceling because they don't want to get exposed or come to the hospital. The other thing that's happening is we're using telehealth. So maybe we're not seeing patients as frequently in the wound care center. And we know how important routine debridement can be. So having an agent that can mechanically remove some of that debris or bacteria is very important, I feel like, at this time, especially, if not all the time. So the other really wonderful thing of trying to prevent patients from getting sick and getting sepsis and going to the OR is when I instruct patients how to use Bosh, it requires no specialty training. It's not a very complicated dressing. It requires no personal protective equipment for the family or caregiver, other than gloves. But as far as like a 95 or splash, like when you're soaking a dressing in a wound for 5 to 10 minutes, it's not a complicated thing, and it's not something where you're splashing it all over the place. So I think that Bosh gives that additional, I don't want to say insurance, but that additional reassurance, perhaps, that your patient is getting the highest level of care that they can, to try to prevent them from having to come to the wound care clinic frequently or having them come to the emergency room with an infection. or just improving their healing rates so that their wound can close, so that they're not having to deal with it, especially in these times. So the use of Bosh has really augmented my practice in helping my patients stay out of our critical care beds, and the patients that do have acutely infected wounds or chronic wounds that end up infected, we found that with the use of Vash that we've gotten them to a trajectory of healing a lot quicker, so that we can get them out of the hospital and back home and into self-quarantining. So everybody wash your hands, stay safe, and I hope you enjoyed this presentation.